Welcome to the Naturopathic Pediatrics podcast. I'm Erika Krumbeck. I'm a naturopathic physician practicing in Missoula, Montana. I wanted to start with, when I started this podcast, I wanted to do one thing. I wanted to take natural medicine seriously enough to really look at the evidence, not to dismiss it, not to just blindly embrace it, but really to look at it and evaluate it critically. Today, we're going to look at Melissa officinalis, which is also known as lemon balm, my favorite herb and my favorite herbal medicine that I use in practice. What I found in the research actually really surprised me, not because it shows it doesn't work, but actually because of how much evidence there really is and how clearly the mechanisms have been explained. And I'll tell you, if I had to pick one herb that I reach for more than any other, and that could be for a fussy teething baby, a stressed out mom, a teenager who can't sleep, it would be lemon balm. It is gentle, it's versatile, and when it's dosed correctly, it's incredibly effective. So today we're going to dig into exactly why. Just an overview of what we'll cover today. We'll do the history and background of the use of lemon balm, the long historical use of lemon balm, active constituents and what they actually do, the evidence base, which is both pediatric specific and general, safety, especially in infants and children, and how I use lemon balm in my own practice, including my preferred formulations for the use of lemon balm. So let's talk about the history a little bit. Just the basics of lemon balm first. It is a member of the mint family, which is a Lamiaceae family plant. It is a perennial herb. It's native to the Mediterranean and Western Asian areas, but it's widely cultivated in Europe and in North America. It grows quite well. It's actually somewhat weedy. I planted it in my garden here in Missoula, Montana, and we don't have a whole lot that survives our harsh winters and our hot summers. And my lemon balm has been so prolific, it's actually taking over the lawn, which is pretty amazing. It spreads easily, unfortunately, so be careful if you plant it in your garden. But if you're looking for a prolific herb and a very easy to grow herb, I would definitely recommend it as one of my first for starting your own medicinal herb garden. It's named Melissa officinalis. The Melissa comes from the Greek word for honeybee. It was actually cultivated to attract bees. And indeed, I have a lot of bees in my yard, which is pretty nice because my yard when we first bought the house was a barren wasteland 15 years ago. And just planting catmint and lemon balm has really perked it up. Lemon balm is known for its classic lemony scent. It's a lemon mint smell, which is really quite pleasant. It's really palatable for kids. Most kids really like the taste. Interestingly, in a tincture form, which we'll discuss about the different forms in a little bit, it turns quite bitter and really loses this nice, beautiful aroma that it has in a tea form or a glycerate form. Lemon balm has a history of historical use spanning 2,000 plus years. It was documented in 300 BC by Theophrastus, who called it honey leaf, and that was in a document called Historia Plantarum. Dioscorides, who's often called the father of pharmacology, described its medicinal properties in De Materia Medica. Lemon balm was formally introduced to Europe in about the 7th century, became very popular with herbalists, writers, and philosophers throughout the Middle Ages. Traditional European medicine has documented use for memory, cognition, insomnia, anxiety, depression, heart palpitations, and even appetite stimulation. Early American immigrants brought it to North America by the 1800s, and lemon balm seeds were regularly advertised in newspapers around this time. The interesting part historically, and I think this is what's so interesting to me about herbal medicine in general, is we can look at the research applications and we can look at the historic and traditional use for herbal medicine to try to kind of find these common threads, because oftentimes that's what research backs up is the traditional and historic use. Not always. That's why I think research is really important. But I always find it really interesting when we take these historical traditions and then find true clinical application that's evidenced in research. The thread across every culture in this case is this property of calming, sleep support, mood support, and cognition, which is really interesting because that's not something that we classically think of for lemon balm currently. Usually anti-anxiety, calming, and insomnia. So it's not coincidence. These are the applications that we find in clinical research as well. That's been well documented in research. So let's transition a little bit. Let's talk about constituents. I have mentioned multiple times, YouTube videos in the past that understanding active constituents is really important. There's this misnomer in herbal medicine, particularly the mommy blog herbal medicine world, that using an essential oil is just a concentrated version of using the herb itself. And that is not true. Are essential oil compounds in lemon balm. That is absolutely true. But just distilling essential oil out of the plant means that we lose a number of the active constituents that are not essential oil. So in this case, like polyphenols are really important. There are other things that are just so important that we can't get just by concentrating in essential oil. And oftentimes when we concentrate essential oils, those are fat soluble. Of course, they're essential oils. They do tend to cross the blood-brain barrier. That can be good or bad, because concentrated essential oils crossing the blood-brain barrier can be linked to seizure activity in children in some cases. I wrote a blog post about that, 13, 14 years ago. Unfortunately, I think I scared a lot of people, but that might be good. That was the height of the essential oil era, where parents were really overusing essential oils and not understanding how concentrated their effects are. So understanding the different constituents is so important because we need to know what constituent it is, whether it's extracted in alcohol, in water, in both, so that we can understand how a different preparation of the herb could be most effective. Then we have phenolic acids, rosmarinic acid, or also called RA in some trials, is really the star of the show. It is what the most research is on right now. It is present in very high concentrations in lemon balm. It's also the most commonly standardized biomarker that's used for quality control in commercial extracts. It's also found in a number of other plants, by the way. It is a potent antioxidant and anti-inflammatory constituent. It also has some very interesting anxiolytic effects. And this is what I discussed in that Instagram reel. It has direct GABA effects in the brain, similar to benzodiazepines, but much, much gentler. It has this dual GABAergic action. It both inhibits GABA transaminase, which means less GABA breakdown, which means more GABA is available. And it directly binds and activates GABA A receptors. It's like a GABA A receptor agonist, which is the same receptor target as benzodiazepines. So lemon balm hits GABA from two angles simultaneously, which makes it very effective as an anxiolytic, but doesn't seem to have the same addictive properties, unless you're addicted to the lovely smell of lemon balm, that a benzo user might have. And it doesn't seem to have the properties of, being concerned about mixing with alcohol, though, of course, I'm sure you could overdo that if you take way too much. And it doesn't have concerns of, use while operating heavy machinery or driving a motor vehicle. Other important actions for rosmarinic acid: it also inhibits acetylcholinesterase, and it does raise acetylcholine levels, which is the same mechanism as Alzheimer's drugs. So I think that's really cool. A little bit less research on lemon balm for Alzheimer's, and it's not necessarily a traditional use, or maybe perhaps less considered of a traditional use from what I think of for the use for lemon balm. And then antiviral activity: it's been shown to inhibit enterovirus 71, which is the hand, foot, and mouth disease virus, at least the common strain that most commonly causes hand, foot, and mouth disease in most regions of Asia. And it inhibits the viral attachment and replication of that virus. Lemon balm is a potent antioxidant, again, shares some of the antioxidant activity that chamomile does, which is a great antioxidant herb, by the way. A lot of antioxidant, anti-inflammatory activity is relevant to really almost every chronic condition we treat, again, because it's safe, tastes great. It's a really useful therapy for, again, a number of inflammatory conditions, especially when it overlaps with an anxiety picture. And then there is a little bit of smooth muscle relaxation and antispasmodic effect as well, which makes it really useful for spasmodic GI conditions like irritable bowel syndrome and colic for babies. So let's go through evidence. What does the research really show for use of lemon balm? I could probably talk for hours on this. I thought, again, that I'd have a few studies to talk about. There's actually 50 to 100 maybe individual studies and then some. I highly recommend reading Dr. Andy Turner's long summary article on lemon balm, which you can find on pro.naturopathicpediatrics.com. It's called Nature's Soothing Secret. So you can do the search term lemon balm and then scroll down for Nature's Soothing Secret. And it's a great summary for the use of lemon balm. Before we start about research in lemon balm, just a bit of a frame here. Research in botanicals, there's always limitations. There's often publication bias. They're almost always small sample sizes. Herbal medicine does not have anywhere near the funding that pharmaceutical medicine does. So that necessitates small sample size, which means it can be biased or skewed either for showing no effect or for showing too strong of an effect. But there is quite a consistent evidence base across really multiple health domains. So let's talk about it. First, the most obvious and what I would probably recommend using lemon balm for the most would be for mood, anxiety, and sleep. Most of the use is in adults, but I think that we can also, in many cases, maybe generalize this research could be also applicable to children as well, because there's some sort of similar-ish research for children. So that GABA T inhibition has been demonstrated in vitro, which we already discussed. I'll try to link a lot of the studies below. Rosmarinic acid, of course, is that active constituent. There is a study that showed that Melissa officinalis, lemon balm tea significantly reduced anxiety in burn patients and also reduced their depressive symptoms versus control patients, and also improved sleep quality. So all of that is in burn patients. Led to a 49% reduction in anxiety scores and a 54% improvement in sleep quality. That's a very nice and positive study. Lemon balm I find to be a quite gentle herb, by the way, so I do think you need to dose it a bit higher than we would for most other herbal medicines. There's also a study for insomnia, anxiety, and depression for a combination product for lemon balm and catmint, which is a really nice combination. Both mint family members showed a significant improvement in all three of anxiety, insomnia, and depression versus placebo after 4 weeks. Let's talk about antiviral research. We've got actually a reasonable amount of antiviral research here. Again, hand, foot, and mouth disease, there's some really decent research that lemon balm inhibits enterovirus 71. For influenza, lemon balm essential oil was shown to inhibit influenza replication via really multiple mechanisms. And they found that it actually works synergistically with Tamiflu, oseltamivir, even at very low concentrations. So something that could be really, really useful for patients who are at high risk for influenza complications. There's quite a bit of research for use in HSV and herpes simplex viruses, both 1 and 2. It's been found that aqueous extract inhibits HSV attachment at even very low concentrations, could be used topically or internally. And then for our pediatric specific evidence, it's always harder to study pediatric populations because standardized surveys aren't applicable for especially small children. We're relying on parents to give us subjective or objective information, and that can be really tricky. Most of the research is in sleep or restlessness in sleep or colic. And then there's some pretty strong research for PMS in adolescent girls as well. In restlessness, a lemon balm and valerian combination found significant improvements in dysomnia, 70% improvement in restlessness, really well tolerated, no adverse effects. Great combo to give, very safe, easy first-line intervention for patients. Also seems helpful for patients with hyperactivity and concentration. So these were not patients that were necessarily diagnosed with ADHD, but had hyperactive symptoms. Reduces the sleep deficits and improves hyperactivity, impulsiveness, and focus in these patients. Parents also reported improvements in social behavior and sleep, which is really cool. There's a couple studies into the use of lemon balm for colic, which is really nice. Lemon balm was found to have significantly lower daily crying time versus simethicone, which is the most commonly given gas drops for babies. And a combination product of chamomile, fennel, and lemon balm also showed significantly reduced crying time versus a placebo. And then one of my really favorite studies lately is use for PMS in adolescent girls. 1,200 milligrams found a significant reduction in PMS symptoms over 3 months. 600 milligrams found significant improvements in physical, psychological, and social PMS symptoms. 600 milligrams, another study found significantly lower psychosomatic symptoms, anxiety, sleep disorder, and social function disorders. I like that one. PMS, we don't have a ton of interventions. I feel like conventional medicine often reaches for oral birth control pills, which is appropriate if the patient is sexually active. But for a lot of young teens, if they're not, especially for the first few years of cycling, PMS can be very bothersome. This could be a very gentle intervention in an age group where anxiety just statistically tends to be very, very high. So let's talk about lemon balm in pediatric practice. This is where I'd like to spend a little bit more time. Lemon balm is, again, one of my most used herbs for children. And of course, a lot of providers are not using it. Maybe my fellow naturopathic pediatricians are, but it's something that I would love to see other pediatric providers use and feel comfortable with, because I think it is very gentle. It's not too difficult to find, at least in tea form. You can also order it in glycerate form on the internet pretty easily. I have noticed a lot of health food stores starting to stock the glycerate form as well. And I think it should belong in most pediatric providers' toolkits. It's gentle, great for anxiety, great for stress. I use it anywhere from 4 months and up, unless it's a very underweight baby. We can dose it by weight, and I have more information in my dosing guides, my 24 herb guides that are for sale on my naturopathicpediatrics.com site. Really great safety profile. Again, dosed a little bit higher than a traditional herb. It also works really well with other herbs in a formula. So chamomile, valerian, passion flower, and you could kind of pick and choose what the effect is, more for sleep, more for antioxidant support, more for stress, more for pain. We often give lemon balm with passion flower glycerate actually for a teething syndrome or pain. And then it tastes great. So in a glycerate or tea form, it's really quite lovely. I often use lemon balm for teething syndromes in babies. We don't need to give something to children who are teething all the time. Teething is a normal part of being a baby. And most babies don't need something for the entire duration of teething. Babies are going to be teething for weeks to months, really. And if we can manage that by having them chew on wooden spoons or a cold, wet washcloth. Anything that is cold doesn't tend to numb the gag reflex, because by the time the cold, water or whatever we're using, it hits the back of the throat, it is well melted. So we don't have to worry about aspiration like we do for Oragel or for clove extract. I've seen some parents do that I don't recommend. But when babies are quite bothered, and especially when they're on maybe day 2 of teething and it's disrupting sleep, it can be a really nice adjunct there. I also use it for colic for kind of the same sort of thing. Babies are a little bit colicky, and you can manage it by bicycling their legs, by, really doing burping well, by making sure we're not feeding babies super gas producing foods as their first solid food. We can just manage it that way. But I do like it for babies who continue to be colicky, especially when probiotics don't seem effective, because that's my first go-to. And then for viral illnesses for all ages, including babies, there are nice antiviral properties. And it helps support and calm really irritable babies when they're sick. And again, I find very, very, very safe. So it's a really nice one to add right away. As for any antiviral herb, it's most effective when given immediately. If we wait more than 24 hours after symptoms start, the antiviral property is no longer going to be effective, though the antioxidant properties and the calming effect would still be present. For toddlers and young children, I often use a lemon balm for sleep difficulties or night wakings. I'll use that probably first, then maybe a valerian glycerate. Of course, I talk about, melatonin quite a bit and the pros and cons of melatonin. I don't typically use melatonin for very young children. So I would probably use lemon balm first. I really prefer that parents aren't giving their kids something every night to fall asleep. But for some kids, resetting their sleep-wake cycle with a daily use of lemon balm or passion flower for, say, 2 weeks can kind of reset them. And help them reduce that association of I'm going to sleep and now I'm going to stay up or party or be anxious or be mad at mom. I think it could be really helpful for that. And then for school-age children, again, the use for hyperactivity and focus. Kids with ADHD almost always have a sleep problem as well. I love doing lemon balm as an intervention for that group because it can help the sleep and seems to improve focus, similar to using something like theanine. Great for anxiety for children, great for test anxiety, great for IBS associated with anxiety. We can use it with theanine, which is really nice. And again, doesn't tend to be sedating until we get to really high doses. So it doesn't affect cognition until it's dosed a little bit too high. Safety and dosing. there is quite a bit of robust safety data across essentially all human clinical trials. Lemon balm was well tolerated from infants to adults greater than 80 years of age. Adults tolerated 5,000 milligrams a day for 20 days with no adverse events. That's much higher than I typically give. I mean, I would typically give somewhere in the realm of 1,500 to 2,000 milligrams a day. In like a tincture or glycerate form, I will give somewhere in the realm of a teaspoon, teaspoon and a half, up to 3 times a day. So about 7 mils up to 3 times a day for an average sized adult. And we often then dose by weight for children under that. Pregnancy, it's considered pregnancy category B2, which is pretty decent. I think almost all traditional herbalists and midwives consider this herb safe in pregnancy, but as always, we never quite have enough data in pregnancy to make really confident recommendations. I would not recommend the use of essential oil for pregnant patients or breastfeeding patients, or really in infants and children. I think lemon balm is probably safe in appropriate doses. Again, that caveat is the precise dosing. That's where mistakes could happen. Other precautions, if someone's on a benzodiazepine or sleep medication, it could potentiate that sleep medication. So I would not necessarily recommend combining. I would probably either lower the dose of the sleep medication or try this instead of the sleep medication first. There is a little bit of evidence that a higher dose can cause paradoxical reactions and actually increase anxiety rather than reduce it. Again, some of these doses that they are giving, which actually I appreciate in some ways in the study that they're not underdosing. Oftentimes in herbal medicine studies, they underdose to such a ridiculous degree that we're never going to see a therapeutic benefit. But some of these are dosed quite high and we really don't need to. So I think starting low and going slow is very, very wise. There has been a long conversation about the use of lemon balm and thyroid. Lemon balm is used historically to treat Graves' disease. Because of this, it's been discussed quite a bit to not use lemon balm for patients who are hypothyroid. I think that that's probably way overkill. I'm sure that in situations of way overdosing patients, giving incredibly high doses, we could see some hypothyroid effect for someone who has a low thyroid or is considered euthyroid, so someone who has already normal thyroid function, but I would find it be very unlikely. So for right now, using it to lower high thyroid symptoms and Graves can be helpful, but I think it's overkill to be super concerned about its use for patients with low or normal thyroid function, personally. So that's just a note of caution. Maybe test TSH if you have a patient with Hashimoto's thyroiditis and you're concerned, or a patient seems to be trending in a hypothyroid symptom direction, but I have never seen that clinically happen in my practice so far. Let's talk about formulations. Again, glycerate is my preferred formulation for children. There's no alcohol. It's a sweet taste. It obviously does not extract all the constituents. It doesn't quite extract the high essential oil constituents as much, but it does some. I use that most often for most patients in my practice, actually. Tea is another really great way to dose. Again, it's quite weedy. So if a parent, patient, anyone, member of the public has it growing in their garden, you can use fresh or dried, but I find that fresh is even a little bit better because you get a little bit more of the essential oils. Really important to infuse for a long period of time for 10 to 15 minutes covered. If we do it covered, then we will keep the most of those essential oils in. Really nice odor and aroma. Tea is a really nice thing to do for anxiety and insomnia anyways, because it creates this calming ritual, something that we can do that helps calm us, that helps create this soothing, just ritual is the best way to describe it, I guess. The warmth of the tea is quite nice. Having a nice mug in your hand is really nice. And then other forms and extracts, tinctures are available. I find they're very bitter and somehow lose all the magical, delicious quality of a glycerate or a tea and turns it a quite horrible tasting concoction. I do sometimes use a 50-50 tincture and glycerate blend, which sort of calms that down a bit, but tincture alone is pretty horrible. So I wouldn't recommend that alone. Encapsulated extracts have been studied in doses quite high. I would typically aim somewhere in the 1,000 to 2,000 milligram extract for adults, and most of them are standardized to a rosmarinic acid percentage, which is quite nice. And then we can use essential oil as well. Not my top essential oil, honestly. Lavender essential oil has way more data, and I would probably do that. We can use it topically for herpes simplex virus lesions as well. So for some pediatric dosing principles, I do have dosage calculators and dose by weight guides in my 24 herb guides ebook that's available at naturopathicpediatrics.com. That's really meant for parents. Providers can purchase that as well. A lot of providers, if you have the adult dose of the herb, then you can make dosage calculations for a pediatric patient. 300 to 600 milligrams of standardized extract, 2 to 3 times per day, or 1.5 to 3 grams of dried herb per day. Underdosing, again, is just not effective, but overdosing might be too much. Dose once per day and then increase the frequency of dosing. I do think it's great to mix with other combination formulas. Again, chamomile, fennel is a wonderful combination. Valerian and lemon balm for sleep. I'll use lemon balm and passion flower for pain and teething. We could do chamomile, lemon balm, ginger, and maybe some bitters for like an IBS or colic type situation, depending on the patient. It is really literally my number one herb that I use in clinical practice for a lot of teething and viral infections. It is just so nice in viral infections for parents to have something on hand to use right away. It's so safe. It's so gentle that if it ends up being a placebo, at least it's better than a placebo that would be a harmful medication. Parents, want antibiotics. They want all the things. They sometimes want to overtreat with Tylenol and ibuprofen, which of course I have a whole video about what that evidence is regarding acetaminophen and the potential link there with neurodevelopmental disorders. So with just caution in mind, a reminder that acetaminophen containing products are a common overdose. So if we can reach for something else first or in adjunction to or rotating with some like antipyretic medications, it could be really helpful. If we can give something instead of artificially suppressing a fever, I think that could be very, very, very helpful for parents to have on hand. So research limitations, there are so many research limitations and challenges here. Even though there is quite a host of research, I would love to see more. There's still a problem with standardization in lemon balm research. There was actually a 2024 review that found that only 6 of the clinical trials even reported the phytochemical breakdown of the lemon balm extract that they use. So that's really challenging because if we're using different extracts with an unknown rosmarinic acid content, we can't really compare. I will post my favorite 2 studies that are actually just reviews of lemon balm below this podcast and video link. And there's a really lovely long description of the medicinal constituents, where they've been studied, how they've been studied, and in what concentrations for anyone who's really interested in diving very deep into the literature on lemon balm. But that said, the lemon balm's evidence base is pretty consistent, and we've got decades to hundreds to thousands of years of historical use, which is always kind of nice too. There's some discussion about using maybe MRI spectroscopy to measure GABA levels in vivo, which would be really exciting. And I'm sure that if I find that research coming out, I'll post it as a Monday study rundown on pro.naturopathicpediatrics.com. So summary here, lemon balm has been used for 2,000 years for good reason. We've got so much fun stuff here. I hope you found this information helpful and useful. I would definitely consider having it in your own family's medicine cabinet. And if you're a pediatric provider, recommending families to have it on hand for colic, for sleep, for teeth grinding, for viral infections. It's super safe. It's a really great one to have on hand for just about everybody. If you're not already using it, I encourage you to start. Try it with your next teething baby in your practice, next anxious school-aged child, and your next patient who's maybe not sleeping well. I think you'll be as impressed as I am for the use of lemon balm. If today's episode was useful, please share it with a colleague, parent, whoever needs it. You can find me on Spotify, the Naturopathic Pediatrics podcast, and YouTube at Erika Krumbeck, ND, FABNP. Subscribe wherever you listen and leave a review if you're willing to. Here at Naturopathic Pediatrics, we are committed to combining evidence and natural medicine. I'll see you next time.